Hello, my name is Emily Todoranu, and I am doing my young adulthood presentation on a condition that affects many women and is known as polycystic ovarian syndrome, or PCOS for short. I chose this topic because my older sister was diagnosed with PCOS last year, so this subject really hits close to home. I didn't really know much about the condition until she told me about her diagnosis and her experiences with it. After that, I was curious to find out more about the condition and its effects on people. In this video, I am going to be discussing these topics. What is polycystic ovarian syndrome, its effects and symptoms, its causes and risk factors, how it gets diagnosed, current treatments for it, how to manage it, and its importance. What is polycystic ovarian syndrome, also known as PCOS? PCOS is a complex medical condition that affects the ovaries and occurs due to hormonal imbalances and metabolism issues. One research article stated that it is typically characterized by anovulation, infertility, obesity, insulin resistance, and polycystic ovaries. PCOS affects about 5 to 10% of women of all races and ethnicities that are of childbearing age, which is between 15 and 44 years old. Most women are diagnosed with PCOS in their early adulthood, which is their 20s and 30s. A fact that I found interesting was that according to the National Institutes of Health, PCOS is the most common cause of anovulatory infertility. Many women don't find out that they have PCOS until they have trouble getting pregnant. And one more thing that I want to emphasize in my presentation before I go further is that while PCOS is mainly associated with women, it can also affect anyone with a uterus, which may include some transgender and non-binary people. For the sake of keeping things simple, I'm going to mainly use women in my presentation, but the things mentioned here can apply to those other demographics as well. The common effects and symptoms of PCOS may include missed, painful, irregular, and/or unusually light periods, large ovaries or ovaries with many cysts on them, excess body hair on typically male areas such as the chest, the stomach, and the back, which is a condition known as hirsutism, weight gain or difficulty losing weight, acne, oily skin, skin tags, which are extra pieces of skin on the body, and/or thick/dark patches of skin, thinning hair or male pattern baldness, and even infertility. Infertility may be caused by a condition known as anovulation, which is when the ovaries do not ovulate or release an egg. As a result, the ovulation phase of the menstrual cycle does not occur. However, it is still possible to get pregnant with PCOS if it is treated properly. So this is what a normal ovary looks like compared to a polycystic ovary. The cysts on an ovary with PCOS look almost like pearls. And this is what the top picture, this is what hirsutism looks like, which is when a woman has extra facial hair on either like her face or like excess hair on typically male parts of her body. And these are what skin tags typically look like. They're little pieces of skin that just dangle off your body. The exact cause of PCOS is still unknown. However, there are some factors that might play a role, and these include genetics. PCOS runs in families, so an individual's risk may be higher if they have an immediate female relative with PCOS. Another factor is insulin resistance. Insulin resistance is when the body's cells do not properly respond to insulin, leading to a buildup of it. High levels of insulin may lead to higher levels of androgens, which are also known as male hormones. Insulin resistance is common in women with PCOS, especially those who are overweight or obese, have unhealthy eating habits, are sedentary, and/or have a family history of diabetes. Another factor that may lead to PCOS is imbalanced androgen levels. Androgens are sometimes called male hormones, but all women make small amounts of it. Women with PCOS have higher levels of androgens than normal, which can prevent ovulation during the menstrual cycle and can cause extra hair growth and acne. PCOS can be diagnosed in several different ways, such as a physical exam. In a physical exam, a doctor will measure blood pressure and body mass index, look for extra hair or skin discoloration, and may look for signs of other health conditions. A doctor might also perform a pelvic exam, which is when they will look for signs of extra male hormones and check if the ovaries are enlarged. PCOS can also be diagnosed by reviewing medical and family history, as well as through a pelvic ultrasound. And in a pelvic ultrasound, a doctor may use a sonogram, which is an image produced by sound waves, to examine the ovaries and check the lining of the uterus for any abnormalities. And blood tests may be used as well to check for excess androgen levels, high cholesterol levels, and to test for diabetes. Unfortunately, there is no single comprehensive treatment for PCOS, so physicians often treat patients based on specific symptoms, and treatment might change slightly depending on if the patient plans to become pregnant. If a woman plans to become pregnant, she has a few options. She may need to undergo some lifestyle changes, such as changing her diet and activity levels. Another thing she can do is take some medications to cause ovulation. And if nothing else works, she may decide to take some fertility treatments, which includes taking certain medications and doing certain procedures like in vitro fertilization. If a woman does not plan to become pregnant, she also has a few options, such as birth control pills, anti-androgen medicines, which hinder the effect of androgens, diabetes medicine, which is used to lower insulin resistance and may help reduce androgen levels. She might also need to undergo some lifestyle changes, as mentioned above, and she may also decide to take some medications to treat other symptoms like acne or excessive hair growth. There are several different management techniques for PCOS, such as weight loss and reducing caloric intake, which can reduce the level of free testosterone in a woman's body. Excess testosterone can lead to PCOS-like symptoms, such as acne, extra body hair, and even infertility. Another way to manage PCOS is through obtaining a diet plan that is best tailored to a woman's specific nutrient needs. Increasing physical activity can improve insulin sensitivity, and taking supplements that support the body, such as vitamin D, omega-3s, and folic acid. There has even been some success with complementary alternative medicine in reducing the severity of PCOS, such as psychotherapy, yoga, and Tai Chi. So PCOS is really important to know and be aware about because it is one of the most common hormonal condition that affects women of childbearing age. It is actually estimated that about 70% of cases of PCOS are undiagnosed worldwide. And the World Health Organization stated that the biological and psychological effects of PCOS, particularly those related to obesity, body image, and infertility, can lead to mental health challenges and social stigma. These are the sources I used for my presentation, and the specific source that I used for a particular slide is noted at the bottom. Thank you for watching.